Hello, everybody. This is Gary. Today is Friday, October 14th, 2022. It's 2:03 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, I'm doing okay. I'm sticking to my daily schedule. As far as my psychiatric symptoms are concerned, my auditory hallucinations are down. They're at a bare minimum. They were a little bit worse a couple of days ago. My paranoia and delusions are not that bad today. I did go outside today for exercise and walking, and I wasn't as paranoid as I often am. I wasn't really thinking people were following me or spying on me or trying to hurt me. Um, it also helps my auditory hallucinations were down because that's part of my paranoia. My voices tell me people are following me or spying on me or plotting against me. My depression is certainly not that severe today. Anxiety levels are pretty low. Um, and like I said, the paranoia and delusions are not that strong today. I saw my peer support specialist yesterday. That's a person who works on staff as a counselor at the mental health clinic I go to, who has a mental diagnosis herself. I saw my therapist the day before that, and we just went over a lot of different things that have been going on. I have been able to avoid going to the psychiatric emergency room for a few months, and that's a new record for me. I would say in the past year, I've only gone to the psychiatric emergency room twice. Once last October, and another time a few months ago. But I've generally been able to avoid it, and that's a good thing because the psychiatric emergency room is chaotic, sometimes violent, certainly noisy. It's not a place where you get to rest or be calm because it just is not restful or calm at a psychiatric emergency room. It's chaotic and it's confusing both for the staff as well as the patients. Generally speaking, like I said today, I'm just keeping to my daily schedule. I did some work on my computer. I do consumer surveys for extra money. I making this video is part of my daily schedule. Um, I did some morning meditation. I'll do some evening meditation tonight. Um, but I'm just basically doing okay today. There's not really much to report on. My symptoms are not that bad today. Um, my anxiety levels do seem to have gone down since we increased the amount of Klonopin I'm allowed to take every day. I'm allowed to take 3 tablets a day. Each tablet is half a milligram of Klonopin, and I'm still on the reduced dosage of Zyprexa because it's possible that Zyprexa caused me to have urinary retention a few weeks ago, and I had to have a urinary catheter placed into my bladder for 2 weeks so my bladder could drain until we reduced the Zyprexa. And the urologist removed the catheter to see if I could urinate normally again, and I could. But whether or not it was actually the Zyprexa is hard to say because I also had a urinary tract infection, and that could have been the cause of the urinary retention. So we don't know for sure that it was the Zyprexa. I saw my primary care week before last, and she's concerned about my weight. I think I'm up to 220 pounds, and I'm only 5'9", so I'm definitely heavier than I should be. And she's still concerned about my blood sugar levels and my cholesterol levels, and would prefer that I control both of those through diet instead of adding medications to my rather long list of medications, both prescription and over-the-counter medications. I would like to report that I haven't had a cigarette in about 12 months. I'm still using nicotine lozenges. It's hard to quit nicotine. Right now I'm just concentrating on avoiding cigarettes, and it's been about a year since I've actually had a cigarette. Tomorrow's my birthday. I turn 57, So I'm definitely getting older. I'm not 20 years old anymore. Um, Aches and pains are certainly there as you get older. That's just a part of aging. Um, I do take some medications for pain. None of them are opioid drugs. I take an antidepressant, Cymbalta for physical and nerve pain. I take Neurontin for nerve pain. And I also take Flexeril for back pain, and I take Tylenol and ibuprofen as needed for other pain like arthritis pain or the pain that I still have in my right knee after surgery, um, but no opioid painkillers. Um, so that's all the report for now.